Hello everyone, Zoe is here with another video and another guest. Today I'm going to interview Soheil Adeli. He's an interface manager in New South Wales Health Sydney in Children's Hospital Network. If you want to know more about his responsibilities and what he does, or if you want to be an interface manager in the future, watch this video. Hi Soheil, how are you? Thank you for joining us today.
Hi, Zoe. My pleasure. Thanks for having me.
Awesome. So Soheil John, to start, can you please tell us a bit about yourself, your career, what do you do, and how was your career journey so far?
All right. Yeah. So my title at the moment is Interface Manager, and I work for New South Wales Health Department and based in Sydney Children's Hospital Network, which covers all the children's hospitals across Sydney. So I'll tell about a little bit about what I do at the moment, and then I'll just go back and tell about my background and the journey that I took to get to where I am at the moment. All right?
Perfect. Thank you.
Many people ask me, so what do you mean by interface manager? So what is your job? What do you actually do? So the area that I work is like an IT environment specialized for health organizations. So since last couple of years, many organization or health organization across the world, they move towards being digitized, being paperless. And that requires building a lot of systems, everything that you as a clinician used to write down and save it on a paper. Now they all need to be digitized. And that brings with, it's got its own issues. It's got the security issues. Many people discuss that. Mm-hmm. And so within this area, now there are a lot of specialties developed. So, for example, I'll give you some examples. So I'll just give you a little journey, for example, from the time a patient enters hospital up until the time that exits the hospital. So what happens, and then I'll try to explain what is my role in this journey. Mm-hmm. So patient comes to the hospital, then goes to the front desk. They admit the patient. There's a system. They enter patient's information, like the patient's name, details, address, and then all the patient's history. Then the patient goes, the doctor comes and take patient's a history, all the any allergies, medical histories, all the information are saved in the patient file. All right. Then depends on the situation. The patient may have a planned surgery, maybe stay in the hospital for a couple of days, may require to do an X-ray, and may go to a pharmacy, medications, all those things. So for every single of these systems, we call it as third-party systems, they have their own system. And they need to be able to communicate together and talk. So the patient information, the correct information needs to be available for the correct people at the right time. Mm-hmm. So how these systems are connected together, we call it an interface. So a system, a module that enables this system to talk together, communicate. For example, you are in the hospital, in Westmead Children's Hospital. But the pathology center, there are multiple pathology centers that work kilometers away. So, and they work with different hospitals. So this system, we call it an EMR, or electronic medical record system. Mm-hmm. All right, you need to be able to communicate with all those systems. There's a pathology information system, there's a radiology information system, pharmacy systems, theater systems, all these, they call it third-party systems, need to be able to communicate in a secure way because it's patient information. Safety requires all the information to be encrypted and different sort of security. So my job is in build interfaces or like a little modules that are attached to this EMR system that enables the hospital medical record system or electronic medical record system to be able to connect to the other systems. Okay, as soon as the patient have the pathology results ready, the doctor can see the patient results on the tablet. So I just try to give you like a little example to understand and tell you what actually I do and what is this all about. When they call, you may have like EMR, EHR, they're all the same thing, like digitized health system or electronic medical records.
Oh, okay.
All right. Yeah. So now I'll just tell you a little bit about my background and the journey that I took. All right.
Awesome. Thank
My
you.
career path. Yeah. So I initially or still am a registered nurse. So I have a Bachelor of Science in nursing, specialized in intensive care nursing. And I also have a master's degree in health information systems, computer science with the major of health information systems.
Mm-hmm.
So back in the days, like before I came to Australia in 2005. So before that, when I was in Iran, I was doing nursing, but I always had a passion, an interest in IT. And I did some like data management courses, short courses, and I was doing some side jobs as a data manager in my department. So I had a couple of friends here in Australia, and when I was talking to them, they said that here in Australia there are the big developments about like building integrated EMR systems. So like integrated, I mean like a statewide, so all the hospitals they can connect together, and the patient's information can be available across the state. And that would sound very interesting to me. And that time I had a dream. I planned to come to Australia. So that was one of the main reasons that I came to Australia.
This is very interesting. Wow.
Yeah, and I was sort of lucky that time. There was what do you call it, a work and holiday visa available at that time. So I applied for that visa and I came here. And that time, the nursing was very in demand here.
Mm.
So I found a sponsor, an hospital that sponsored me to work as a registered nurse in the cardiothoracic ICU. And so, yeah, I started and I had the obligation to work like for 4 years with them. So that actually gave me a very good opportunity during those times that I could actually study the systems and aside from working as a nurse, I had the chance to actually see how they use EMR, how they are, what sort of people are working in that department. And I always had an interest to just know how do they do it. And I was just waiting for that 4 years to be finished so I can start working. And I tried to go and find some people, like some friends in the IT department, and they start asking questions. Okay, if I want to do this, how can I do it? I'm a nurse. I've got these specialties, and I really like to help build systems that can help clinicians to do their job better. And from there, I get some ideas on how to start. So about 2 years doing nursing here, I started doing my master. It was very hard working full time, studying full time.
Exactly right.
Yeah, it's very hard. So, but you need to have that passion, that courage to move you towards your dream.
Very true. That's what I was going to say. I was like, you always had the passion and you tried to achieve it, right? This is very inspiring.
That is the thing. So you need to be not afraid of change, because many people at that time told me, are you sure you want to resign nursing? Because many people was like still thinking that you're a registered nurse, you got a secure job, you're a full-time employee for the government, you'll get like paid very well. Are you sure you want to just resign and start this? And I said, yeah, I'm so determined and I'm so passionate about what I'm looking for. So, so just after that 4 years, I finished my 4 years working as a registered nurse, and I started trying to find a way. There wasn't like a specific university degree that you can do to let you to start in this job. So you had to find your way. Okay. So for example, most of the people in this job, they have a health background. So in my department, in my team, I've got people like they have a pharmacy background, they're pharmacists. I've got pathologists, radiologists. So these are all the people that at some stage they worked as a clinician or like a allied health or someone as working with the patients, and then they showed interest to work with the health information system and come this side, and some of them still work at both sides, which is really good because it's not the job. It's not like pure IT. When you come to our meetings, when people come from outside, they need to understand what they're talking about. When you're talking with the doctor, when you're talking with the, like a radiologist, they ask you to build a system. You need to understand the language, what they talk. So you need to have that sort of background, which is really helpful. So I started my job as my first job in this field, this area after leaving nursing was like a training officer. So my job was to train new staff, new personnel, like doctors, like physiotherapists, nurses, to train them how to use this system. So I was working in RPA Hospital, Royal Prince Alfred, one of the biggest hospitals in Sydney. And they were one of the first hospitals that moved towards being paperless and using digitized information system. And it was really good opportunity. That gave me that vision how all these systems are connected together, because before I was just a user. Just go to the computer, just check the patient's results, and was just a user, end user. But then it gave me the vision, and I could see how all these systems are working together as an integrated system. And then after a year, by that time I finished my degree, and I did start the job as a data analyst. So my job was to collect data analysis and troubleshooting and find issues within the system. And after a little while, by that time, New South Wales established what they call it now eHealth. So eHealth New South Wales works as an umbrella, looking after all the local health districts in New South Wales. Like a support organization, trying to standardize all these local health districts with all their hospitals to work as a standard and integrated. So
amazing.
Yeah, so I found a position there, and that was very, very good for me that time because it provided me some opportunities to do a lot of courses, so professional courses. So I did work there 2 years, and then I think about 2-3 years ago, I moved to Sydney Children's Hospital as a Westmead, which is a network of hospitals. And I started working initially there as an application manager, and then after 1 year as an interface manager. So to say it, I got my way to where I am at the moment in the course of about 10, 11 years after I left nursing.
That's true.
So I hope I tried to give you some a summary of what I did and trying to provide you some background. Yeah.
That was amazing. Just one question. So which course did you do for your master? So which course is useful for someone who want to do that course,
yes.
like someone who is already in health system and want to be interface manager? What course do you recommend them to study now, or what did you study?
Yes, so what I did was computer science with the major of information systems. So information systems not specific to health information system. It could be for many different information systems, but I use it towards my health. But there are many opportunities now. I try to many people ask me, so it depends on, so if you're a clinician and you work as a nurse, as a pharmacy, or you're a doctor, and you think that you want to stay in the health system, but not just working with the patient directly. You want to be able, you have a passion for IT, for information system, and you want to move toward this side. There's different ways. So the courses now, I think TAFE and some universities, even in Sydney, they have degrees for health information system. There are master degrees for health information system and health administrations, things like that. So you can do those courses. It gives you some vision about how to start, and then you can, for example, last year, I think, about gas, we had 2 pharmacists, fresh, 2 or 3 years pharmacists, and then they joined our team. So because we have different, we call it systems or information system. For pharmacy, we want someone that has the pharmacy knowledge because it's got its own board, all those medication names and allergies. So someone needs to have that knowledge to be able to actually build something to work for that system. So, so another way that actually I took, and some people in my department, have seen recently joined our team, is starting as a trainer. You can, because you worked as an end user, as a clinician, and you know all the system in and out. So you can train other people how to use the system, and then during that time, it gives you some awareness about how these systems are work together. Because when you're doing training, you're actually not building, you're not designing anything, you're just showing how the systems work, all right? Then if you have that passion, that curious, so big, some people are curious, like me, I wanted to know how they are built. I want to build it myself. I want to build it this way. I think if I build it this way, it works better. Then it can come and do what we call it an application specialist in our department. So you can start building your own modules, improvements, and so to summarize it, there is not a specific university degrees, but now last couple of years they started adding it as a health information system and health administration. These are 2 areas that you can start.
So my next question would be as you said, first important thing is that person need to have some health background. But then from data point, do you care about, do they need to know any specific language like Python or something like that? Or you just want them to kind of be a project manager, someone who have that kind of management knowledge to be mixed with that health background? Which one is more important for someone like you?
Yes. If they want, someone like me, it's not a project management or any specific language. Also, it's an advantage because when I'm developing a system and interface, I need to do a lot of queries, database queries. So it's a very good an advantage that you have what we call it is a CCL language. It's a SQL database language. It's good to know it because it helps you, but it's not a mandatory requirement. But we do have, as I said, this field is very now the same as a medical itself, medical environment itself. This a health information system is nowadays is very, very specialized. So it depends on where you work, because I work with projects statewide, very, very big projects, small projects, things. So we do have project managers. So if someone is it doesn't necessarily mean that you need to have health information, but it is very, very helpful because during these projects, your stakeholders are clinicians or doctors or head of departments. So you need to be able to understand the language when you talk to them. So we got project managers. We have our own IT team. So if I have an issue with my PC, I have an IT department so they can come and fix it. So we do have IT, like they are pure IT desktop support. And also we have got application managers, which their job is to build, design, and manage that specific application for that specific clinician. There's a lot of application systems specific for theaters, so they use it in the operating room. So someone with that background is very, very helpful for this job. So they don't need any specific IT language. They just need to just to show passion. They need to, for example, most of the, when you have projects, they go to the wards and ask for interested people. They stick with the norms, say, okay, we're doing this project. We're looking for some people to help us because we need to train the staff and we need to get some information. It's always good to have some people on your side that you can, rather than going to talk to too many people in the ward, you find two key people that for example, nurse unit managers or the team manager, you can find them and then you can train them. Then they can just later, if they show interest, they can come and work with us, on short basis contracts. And then later on, they can find what actually they can do and apply for that position. For nurses, one of the best ways, as I said, for the nurses, if they want to move toward this, what is to start as a training, like a trainer officer, so they can start with that. After 6 months, 1 year, they can start applying for other positions. Because one of the main requirements, if I show you the when I want to employ new people, one of the first number one requirement is that experience in this job. So some people say, how can I start this job without having someone need to start this job? So this is the first entry level, to work as a trainer.
Mm-hmm. That's true, to give them that experience that they can apply for the job.
Yeah, and then during that time, you can develop yourself, make yourself familiar with all the new systems and how they work together, and which one do you want to work? Do you want to focus on training? Do you want to focus on supporting? Do you interested in building and designing new systems, or do you want to talk? Do you want to manage the project? So, and then you need to find the skills required for that. So if you want to be a project manager, you can go do some courses for project managers. We have programs in our field which are programming specifically for those applications. So you can go and do some courses for that specific. So that training position that I told you, that makes you ready to apply for the next level.
That's amazing. Such a great advice. Yeah. So, and can you please tell us a little bit about working hours? So, with what you are saying, it means you must be very busy. Is that like a standard working hours, like 9 to 5, or?
Yes. Yeah, standard, in normal situations, it's standard 9 to 5, but many times we work, you may know, when we work with the projects, you hit deadlines. We work after hours. We have, for the new system, we have go lives. We need to be able to support, to be available to support. So we may do even night shifts. Okay. Yeah. So maybe 3 days in a row, I think 2-3 months ago, there was a new system that was going live, and I was part of that system. So I need to be able there. I had to go to hospital, stay there 3 nights in a row.
Wow.
All right. So because they need to be available 24 hours. The system is in use 24 hours. So, but not always. Generally, yes, 9 to 5.
That's cool. Perfect. And how about salary-wise? Do you think, is that a kind of high-paid job, or you feel like it's all based on hard working? So you have to start from a standard, go up until you get to the point.
It's very, very variable. It depends on how hard you work and how much you experience. So I like now, apart from my nursing experience, which is itself is like about 5, 6 years, I have like about 10 years now experience. So it depends on, you need to go step by step, level by level. So I just give you a range. So if you entry levels, when you come here, it starts from 70 plus, like 60, 70 plus. And then you go analyst, you go specialist, you go manager, and then how far it goes to 100 plus, 130 plus, and it goes like that. But and depends actually like many people in this field, like after a while you're very experienced, you can work as a freelancer, like as a consultant. So a couple of my friends, they were with more experience, so now they work for themselves. So they have their own business and they provide consultation. So you're not tied up to a fixed hour. You can work whenever you want. You can pick up your time. So that is the next level.
Yeah, perfect. And do you think is that kind of a job in demand in Australia?
Yes, and especially recent years, it is, and it is something like happening internationally. It's not just Australia. So America, United States, Europe, they're all moving towards this area. So what they call it, they say we are going paperless. So we're going digitized. So it is a lot of job, and there are different vendors. The system that I'm working with, the vendor is an American company, Cerner. It's called Cerner. So they have like branches across all over the world. It's not localized.
Perfect. That's amazing. So at the end, Soheil, can you please give any tip or advice for students who are graduating from university and they have this dream in their mind that in the future they're going to be a interface manager, or if someone is already as a nurse, radiographer or something in kind of like health department, and they decided to change their career in a way that you did. So what is your advice for them and how they can achieve their goal?
So I can give a general advice. This is something that I did, and I always tell other people. And it's not just specific to this job. This is specific to any goals that you have. So what I say is that you follow your dream. All right. So if you have a dream, just don't let go of it. All right. Just follow it. So it might not be only the job. It might be anything. But saying that, many people or a lot of people, it will stay always as a dream. So you don't want that. All right. You want to achieve that dream. So what you have to do to make that dream to come true? So you have to make it as a goal. So how to do that? So I just tell myself as an example, how did I do that? So I was always had this dream to do this job. And you need to make that as a goal. So the difference between a goal and a dream is that a goal has, you plan for it. It has a deadline. So you need to change your dream to a goal by having a clear vision of what you want. So it might not always be your perfect job. You, for example, your dream is to have like a very beautiful car. Okay, so you want to buy this car. So just dreaming that, you need to have a clear vision. What sort of car is it? What color is it? How much is it? Where can I get it cheaper? When do I need it? So this is, you can apply this to anything. So I want to do this job. I want to be a program manager. I want to be head of department in this area. So what is the requirement for this job? What sort of skills does it need? What sort of skills I need on the technical level, on the personal level? How can I do it? Those sort of stuff that if you plan it, you have to have a clear vision and then you plan for it. So I need these skills. Okay, I need to go study IT project management. I need to go study this. And then you put a deadline for it. that gives you a passion and courage to move towards it. Don't lose your path. And the other thing I always did myself is that to imagine yourself in that position. So I was doing nursing night shifts and I was walking by the IT department. I was looking at the window. I said, one day I will be sitting there and I will be working here.
Gosh, this is very
So,
interesting.
yes, you just need to imagine yourself in that environment. That gives you can't believe it, it gives you a courage, a passion. Just sometimes you get distracted by all the daily activities, all those things that distract you out of your mission. So you need to imagine yourself in that position, plan for it, and I'm sure that you can achieve your goal.
That's amazing. Thank you. That was such an amazing advice. And I'm sure it's going to be very helpful for anyone who is looking to be an interface manager in the future.
Yeah, and one more thing, don't be afraid of change. Okay? Change is a good friend because some people are in my path, they just don't like change. They want something steady. So if you want that, you will be like steady. But if you want to improve, you want to go up, you need to work with change. You need to change yourself. Yeah.
Okay, guys, hope you enjoyed watching the conversation. If you have any question, please comment below or on my Instagram page. Don't forget to give me a thumbs up and subscribe to my channel if you want me to produce more video like this for you. Thank you.